In electrotherapy, electric current is the flow of charged particles through body tissues via electrodes. This current stimulates nerves, muscles, and body tissues to produce the therapeutic effects such as pain relief, muscle contraction, tissue healing, and improved circulation. For this, different kind of currents used like direct current, alternating current, and pulse current. Direct current is the continuous flow of current in one direction. It has constant polarity. It is used to stimulate the denervate muscle. It is used for iontophoresis, meaning delivery of drug through skin, and also used for wound healing. Alternating current is most commonly used in our household. Most common frequency is 50 hertz. It changes its direction periodically. It has no fixed polarity. Most commonly seen in medium frequency currents like IFT, and pulsed current is the most common used current in rehabilitation. It is the flow of current in pulses separated by the intervals with no current. It is used in TANS, neuromuscular electrical stimulation, and functional electrical stimulation. This current stimulates nerves and muscles by reducing the skin irritation, and thus it is more comfortable than continuous current. On the basis of the frequency and clinical use, currents can be low frequency currents, medium frequency currents, and high frequency currents. And frequency is less than 1000 hertz, it is low frequency currents like Faraday currents used to stimulate the innervated muscles and for re-education of the muscles. It has short duration and it is more comfortable. Interrupted galvanic current is used to stimulate the denervated muscles. It has long duration and it is less comfortable. TANS is used for both chronic and acute pain relief. Functional electrical stimulation and neuromuscular electrical stimulation is used for muscle strengthening and functional training. Medium frequency currents when the frequency is between 1000 and 10,000 hertz. Clinically, it is used in IFT, Interferential Therapy, and Russian currents. IFT में most common जो हम frequency use करते हैं is 4000 hertz. जब हम IFT की setting करते हैं 1 to 10 hertz के बीच में, it is used for the stimulation of the muscle and for reduction of the edema. जब हम इसकी setting करेंगे 10 to 50 hertz, it is used to stimulate the chronic muscle pain and improved circulation. 80 to 150 hertz is used for acute pain relief. Russian currents में most common used frequency is 2500 hertz. It is used for athletes, for sports rehabilitation, and for the strengthening of the muscles. And the frequency is more than 100,000 hertz, it is high frequency currents. And clinically, it is used in shortwave diathermy and the microwave diathermy. SWD is used for heating deep tissues, for pain relief, and for improved circulation. Microwave diathermy is used for heating superficial tissues. In electrotherapy, parameters are the adjustable settings that will decide the therapeutic and the physiological effects of these currents. Most common used are frequency. It is the number of pulses in 1 second, और इसे हम mostly hertz में measure करते हैं. Pulse duration या फिर pulse width. It describes how long a pulse lasts, और इसे हम माइक्रोसेकेंड्स या मिली सेकेंड्स में मेजर करते हैं. जो हमारी बॉडी टिश्यूज में जब करंट्स पास होती हैं वो पल्सेस की फॉर्म में ही होती हैं. वेव फॉर्म इज द ग्राफिकल रिप्रेजेंटेशन ऑफ दीज पल्सेस और इलेक्ट्रिक करंट्स. इट कैन बी द रेक्टेंगुलर वेव फॉर्म, मोस्टली यूज इन TANS and neuromuscular electrical stimulation. Triangular waveform used in galvanic currents and used for stimulation of the denervated muscles. Sinusoidal waveform used in Russian currents and IFT. Amplitude is the strength of the current. It will produce the desirable sensory and the motor effects. Polarity is the positive and the negative characteristics of the electrodes. It is important in galvanic currents. In my further videos, I will describe each of these in detail, so stay tuned.